Hello, I'm Sylvia Azania, and today we're going to talk about what fertility studies involve and what fertility tests are available. So, when a couple goes to a fertility clinic after a certain period of time spent searching for pregnancy without success, a fertility study is conducted for both the man and the woman. These tests are used to try to determine and better understand the possible causes of infertility in the couple, but they also help guide the specialist regarding the most appropriate assisted reproduction treatment. For this reason, a fertility study is also conducted for women who wish to become mothers alone and for couples of women. In this way, the specialist can evaluate which treatment is most appropriate to help them achieve motherhood. For all these reasons, in this video, we are going to talk in detail about when to undergo fertility tests, what the fertility study involves for both men and women, and we are also going to answer some of the most frequently asked questions that users may have regarding this topic. As a general rule, the recommendation is that a couple should visit a fertility clinic after 12 months of frequent sexual intercourse without contraceptive protection if pregnancy has not been achieved during this period. However, in the case where the woman is over 35 years of age, it is recommended that the couple consult a fertility specialist after 6 months of trying to achieve a pregnancy. This is because age significantly impacts female fertility, leading to a decrease in both the quantity and quality of eggs. This way, a fertility assessment can be conducted for the couple, and based on the results, the most suitable treatment will be evaluated to assist them in achieving pregnancy. Additionally, it is essential to note that women who decide to take on motherhood independently, as well as female couples who wish to become mothers, should also undergo a fertility evaluation before beginning assisted reproductive therapies. This way, the specialist can recommend the most appropriate treatment. Initially, a medical history will be opened that the specialist will begin to complete with questions aimed at understanding the general health status of the patients, their personal and family history, as well as their habits. Similarly, the specialist will also inquire about issues such as the duration of infertility in the couple. Additionally, the specialist will request a series of tests and analyses. Nonetheless, the fertility evaluation is different and varies between women and men. Besides a full gynecological checkup and cytology, the primary fertility evaluations that the specialist can request from the woman are a hormonal blood analysis in which the concentration of several hormones will be determined, a transvaginal ultrasound in order to check the status of the ovaries, tubes, and uterus, in addition to counting the antral follicles. If you are interested in learning more about this test and what the antral follicle count is used for, I have included an article in the tags where you can find much more information about it. A karyotype test is conducted to check for any numerical or structural abnormalities in the chromosomes that might be responsible for infertility issues. A hysterosalpingography or hysterosonohysterosalpingography, which both allow the patency of the fallopian tubes to be carefully checked by X-ray or ultrasound, respectively. A hysteroscopy, which would enable direct observation of any uterine abnormalities, like fibroids, to be identified. An endometrial biopsy can be performed, from which it is possible to carry out and conduct various tests to thoroughly analyze the endometrial factor, including the endometrial receptivity test and examinations for microorganisms found in the uterus. However, a woman's fertility study generally does not require all these tests. It is most common for the study to be gradually completed with the tests recommended by the specialist, according to the medical history and the results of previous tests. You will be able to read more detailed information about fertility testing in women in the article I've included in the tags. In the case of men, in addition to a thorough physical examination that may include an ultrasound scan of the male reproductive system to rule out any possible abnormalities, the main fertility tests are the seminogram, that is, a basic semen analysis in which important aspects such as the concentration, motility, and morphology of the sperm are carefully evaluated. This examination can be supplemented with a motile sperm count, or MSC, performed after processing the semen sample in the laboratory in order to obtain more detailed and useful information. I leave you a link to an article where you can read much more information about semen analysis and how a semenogram is performed. Also, a blood hormonal analysis in which the determination of testosterone acquires relevance among other hormones. A karyotype analysis that will help to assess if there are any abnormalities in chromosome number or structure leading to infertility. A DNA fragmentation study of spermatozoa in order to evaluate the integrity of its genetic material. You can discover much more regarding this test in the article I'm sharing in the tags. A FISH test of sperm is conducted to assess whether the sperm have normal chromosome content. A study of Y chromosome microdeletions, which allows us to study if these microdeletions exist, particularly in males with severe oligospermia or azoospermia. A seminal culture used for detecting the presence of microorganisms found in semen. Or a testicular biopsy, which is a procedure that will allow us to evaluate whether there is sperm production in men with azoospermia. Just as in the case of women, all of these fertility tests are not always strictly necessary. The male fertility study is gradually completed depending on the medical history and the results of the previous tests. If you're interested in learning more about male fertility testing, you can read the article that I leave you in the tags. And now we are going to answer some of the most frequently asked questions that users may have related to this topic. Should both members of a heterosexual couple need to undergo fertility tests? Yes, when a heterosexual couple faces fertility problems, both individuals need to have a fertility evaluation done. The reason behind this is that infertility may arise from causes that are either female, male, or a mix of both, indicating that it can be associated with both genders. By doing this, the specialist can provide a more thorough evaluation of the couple's circumstances, thus enabling them to recommend the most suitable treatment to assist in their pursuit of pregnancy. Which one of the two undergoes fertility testing in a female couple? In a relationship made up of two women, the fertility evaluation will be performed on one of them or both, depending on the assisted reproduction treatment that will be applied. When it comes to artificial insemination or in vitro fertilization using donor sperm or even embryo adoption, only the fertility study corresponding to the woman who will undergo the treatment should be carried out. In the case of using the ROPA method, in which one of the women will provide the eggs and the other will carry out the gestation, since more women are actively participating in the reproductive process, both must undergo the corresponding fertility study that will be indicated by the specialist. If you have any questions or want to discuss something related to this video, I encourage you to leave us a comment. If you enjoyed the video, please give it a like, subscribe so you won't miss any of the future videos, and I will include a link in the description to an article where you can find a wealth of additional information related to this subject.